Colorectal cancer is the third leading cause of cancer deaths in the United States. But about 1 in 4 American adults ages 50 to 75 have never been screened, which is the most effective way to reduce your risk. Thanks for joining us for this week's Health News You Can Use. I'm Lizzie Stish. This week, during Colorectal Cancer Awareness Month, we're talking about the life-saving impact of regular screenings and the most advanced treatments that surgeons are doing here in the operating room. With me today is Dr. Robert Amajoyi, a colorectal surgeon at St. Luke's Health System. Thanks so much for letting us join you in the OR today.
Thank you very much, Lindsay.
So, Dr. Amajoyi, screening guidelines have expanded in recent years. Can you tell me when a person should start colorectal screenings and how often they should get them done?
So the age is 45 now. Back in 2018, the American Cancer Society recommended that we start screening at the age of 45 because younger and younger patients are beginning to have colorectal cancer. So it's no longer 50, it's 45.
Okay, so that's for a person of average risk. What if you have a family history?
So what she's alluding to is there's two main risk categories, average risk and high risk. The average risk is you and I who has no personal or family history of colorectal polyps or cancer, while the high risk individuals are individuals that have had either polyps in the past or have family history of cancer. So for those people, it is to be scoped at age of 40 or 10 years younger than that first degree relative that actually had the cancer.
Okay. So even if you haven't had a polyp in the past, why is it still important not to delay that next screening?
Yes, that's a very good question. Again, actually, polyps are very common. So they grow very quickly. So just because you had it 5 years ago doesn't mean that that you cannot develop another polyp. So it is very important to make sure that you continue to keep that regular screening schedule that your doctor recommends.
Okay. Now we're here in the operating room today to talk about the most advanced treatments in colorectal cancer. Can you tell me a little bit about this state-of-the-art technology behind us and how it's used?
Yes, this is a robot, the Da Vinci robot. This is one of those tools in our toolbox that helps us do even the most complex and difficult operations. It is a tool that allows us to accomplish some of the tasks that other people may not be able to accomplish. And it is a tool that helps us in all of our campuses at St. Luke's Health System.
So what are the benefits to the patient of robotic surgery?
So with the robot, the incisions are smaller. And what that means is less trauma, quicker recovery and faster return to normal activities, faster return to work and school for the kids if it's somebody going to school. So not everybody is a candidate for robotic surgery. Obviously, there's other reasons why people may not be a candidate, but most people are candidates for the robot.
Great. Well, is there anything else that you'd like to add today?
So if you are 45 years of age and you are still contemplating about colorectal cancer screening, I have patients that fly across the Atlantic to come and get the colonoscopy done because they don't have it in their countries. But you have this in your backyard. Get screened.
Thank you so much for letting us join you again today.
Absolutely. Thanks for having me.
To learn more about colorectal cancer treatment or to schedule a screening appointment, visit stlukeskc.org/colon-cancer. You can also stay up to date with all the latest news from St. Luke's on stlukeskc.org/news. Thanks again for joining us. We'll see you next time on Health News You Can Use.